What is Herceptin and what is it used for? Herceptin contains the active substance trastuzumab, which is a monoclonal antibody. Monoclonal antibodies specifically recognize proteins or antigens. Trastuzumab is designed to selectively bind to an antigen called human epidermal growth factor receptor 2, HER2. HER2 is found in large quantities on the surface of some cancer cells and stimulates the growth of these cells. When Herceptin binds to HER2, it stops the growth of these cells, causing them to die. Your doctor may prescribe Herceptin for the treatment of breast cancer when have early breast cancer, with high levels of a protein called HER2. Have metastatic breast cancer in which the original tumor has spread, with high levels of HER2. Herceptin may be prescribed in combination with the chemotherapy drugs paclitaxel or docetaxel as a first treatment for metastatic breast cancer, or may be prescribed alone if other treatments have not been successful. It is also used in combination with other drugs called aromatase inhibitors in patients with high levels of HER2 and hormone receptor-positive metastatic breast cancer, cancer that is sensitive to the presence of female sex hormones. What do you need to know before you start using Herceptin? Do not use Herceptin. If you are allergic to trastuzumab, the active substance in Herceptin, murine, mouse, proteins, or any of the other ingredients of this medicine, listed in Section 6. If you have severe breathing problems at rest due to your tumor, or if you need treatment with oxygen. Warnings and precautions. Your doctor will closely monitor your treatment. Cardiac checks. Treatment with Herceptin alone or together with a taxane may affect your heart, especially if you have ever received an anthracycline. Taxanes and anthracyclines are two types of drugs used to treat cancer. The effects can be moderate to severe and can lead to death. Therefore, you will need to have your heart function checked before, during, every 3 months, and after, up to 2 to 5 years, treatment with Herceptin. If you develop any signs of heart failure, i.e., inadequate pumping of blood by the heart, you will have your heart function checked more frequently, every 6 to 8 weeks. You may be treated for heart failure, or you may have to stop treatment with Herceptin. Check with your doctor, pharmacist or nurse before you are given Herceptin if you have had heart failure, coronary artery disease, heart valve disease, hard murmur, high blood pressure, have taken any medicine for high blood pressure, or are currently taking any medicine for high blood pressure. Have ever received or are currently receiving a medicine called doxorubicin or epirubicin, medicines to treat cancer. These medicines, or any other anthracyclines, can damage the heart muscle and increase the risk of heart problems when treated with Herceptin. You feel short of breath, especially if you are currently receiving a taxane. Herceptin can cause shortness of breath, especially when it is first given. This may be more serious if you already have shortness of breath. Very rarely, patients with severe breathing difficulties before treatment have died when given Herceptin. You have ever received any other cancer treatment? If you receive Herceptin together with any medicines to treat cancer, such as paclitaxel, docetaxel, an aromatase inhibitor, carboplatin or cisplatin, you should also read the package inserts of these medicines. Children and adolescents. Herceptin is not recommended for children under 18 years of age. Other medicines and Herceptin. Use of Herceptin with other medicines. Tell your doctor, pharmacist or nurse if you are using, have recently used or may need to use any other medicines. It may take up to 7 months for Herceptin to clear from your body. Therefore, if you are going to take any new medicines within 7 months after the end of treatment, you should inform your doctor, pharmacist or nurse that you have been treated with Herceptin. Pregnancy and breastfeeding. If you are pregnant, think you may be pregnant or intend to become pregnant, consult your doctor, pharmacist or nurse before using this medicine. You should use an effective method of birth control during treatment with Herceptin and for at least 7 months after the end of treatment. Your doctor will explain the risks and benefits of taking Herceptin during pregnancy. Rarely, a decrease in the fluid surrounding the developing baby in the uterus, amniotic fluid, has been seen in pregnant women who have been given Herceptin. This can be harmful to the baby in her uterus and has been associated with lungs that do not fully develop, resulting in fetal death. Breastfeeding. You should not breastfeed your baby during Herceptin therapy and for up to 7 months after the last dose of Herceptin because Herceptin may pass into your baby through breast milk. Consult your doctor, pharmacist or nurse before taking any medicine. Driving and using machines. Herceptin may affect your ability to drive a car or operate machines. If you experience symptoms, such as dizziness, drowsiness, chills or fever, during treatment, you should not drive or use machinery until these symptoms disappear. Sodium. Herceptin contains less than 1 millimole of sodium per dose. This is essentially sodium-free. How to use Herceptin. Before starting treatment with Herceptin, your doctor will determine the amount of HER2 in your tumor. Only patients with a high amount of HER2 will be treated with Herceptin. Herceptin should only be given by a doctor or a nurse. There are 2 different types, formulations, of Herceptin. One is given as an infusion into a vein, intravenous infusion. The other is given as an injection under the skin, subcutaneous injection. It is important to check the drug labeling to ensure that the correct formulation is being administered as prescribed. The fixed-dose subcutaneous formulation of Herceptin is not for intravenous administration and should only be given as a subcutaneous injection. Your doctor may consider changing your treatment from intravenous Herceptin to subcutaneous Herceptin, and vice versa, if deemed appropriate for you. To avoid medication errors, it is important to check the labels on the vials to ensure that the drug being prepared and administered is Herceptin, trastuzumab, and not trastuzumab emtansine. The recommended dose is 600 mg. Herceptin is given as a subcutaneous, under the skin, injection over 2 to 5 minutes every 3 weeks. The injection site should be alternated between the left and right thigh. New injections should be given at least 2.5 centimeters away from the previous site. The injection should not be given in areas where the skin is red, bruised, tender or hard. If other subcutaneous medications are being used during treatment with Herceptin, a different injection site should be used. Herceptin should not be mixed or diluted with other products. If you stop treatment with Herceptin, do not stop treatment with this medicine without first talking to your doctor. All doses should be given at the right time every 3 weeks. This helps your medicine work properly. It may take 7 months for Herceptin to be eliminated from your body. Therefore your doctor may decide to continue to check your heart function even after your treatment ends. If you have any other questions about the use of this medicine, ask your doctor, pharmacist or nurse. Possible side effects. Like all medicines, this medicine can produce adverse effects, although not all people suffer them. Some of these side effects may be serious and may require hospitalization. Chills, fever and other flu-like symptoms may occur during treatment with Herceptin. These are very common. They may affect more than 1 in 10 people. Other related symptoms are, feeling sick, nausea, vomiting, pain, increased muscle tension and agitation, headache, dizziness, shortness of breath, decreased or increased blood pressure, heart rhythm disturbances, palpitations, arrhythmias or irregular heartbeat, swelling of the face and lips, rash and feeling tired. Some of these symptoms can be serious and some patients have died. See Warnings and Precautions section. You will be followed by a healthcare professional during administration and for at least 6 hours after the start of the first administration and for 2 hours after the start of subsequent administrations. Serious side effects. Other side effects may occur at any time during treatment with Herceptin. Tell your doctor or nurse if you experience any of the following side effects. Heart problems can sometimes occur during treatment and occasionally after stopping treatment, and these can be serious. These include weakening of the heart muscle which can possibly lead to heart failure, inflammation of the lining of the heart and rhythm disturbance. This can lead to symptoms such as, shortness of breath, including shortness of breath at night, coughing, fluid retention, swelling of the legs or arms, palpitations, arrhythmias or irregular heartbeat. See Section 2. Heart checks. Your doctor will monitor your heart periodically during and after treatment, but you should notify your doctor immediately if you notice any of the symptoms described above. Tumor lysis syndrome. A set of metabolic complications occurring after cancer treatment and characterized by elevated potassium and phosphate levels in the blood and low blood levels of calcium. Symptoms may include kidney problems, weakness, shortness of breath, fatigue and confusion, heart problems, heart palpitations or a faster or slower rhythm, seizures, vomiting or diarrhea, and tingling in the mouth, hands or feet. If you experience any of these symptoms when your treatment with Herceptin has ended, you should consult your doctor and inform him or her that you have previously been treated with Herceptin. There are two formulations, of Herceptin. One is administered as an infusion into a vein over 30 to 90 minutes. The other is administered as a subcutaneous injection for 2 to 5 minutes. In the clinical trial comparing these two formulations, infections and adverse effects affecting the heart and requiring hospital treatment were more frequent with the subcutaneous formulation. There were also more local reactions at the injection site and more increases in blood pressure. Other adverse effects were similar. Very common adverse effects of Herceptin may affect more than 1 in 10 people. Infections, diarrhea, constipation, heartburn, dyspepsia, fatigue, skin rash, chest pain, abdominal pain, joint pain, low red blood cell and white blood cell counts, which help fight infection, sometimes with fever, muscle pain, conjunctivitis, tearing, nosebleeds, runny nose, hair loss, tremor, hot flashes, dizziness, alteration of nails, weight loss, loss of appetite, difficulty sleeping, insomnia, altered taste, low platelet count, bruising, numbness or tingling in fingers and toes, redness, swelling or ulcers in the mouth and or throat, pain, swelling, redness or tingling in the hands and or feet, shortness of breath, headache, cough, vomiting, nausea. Common side effects of Herceptin may affect up to 1 in 10 people: allergic reactions, throat infections, bladder and skin infections, inflammation of the breast, liver inflammation, kidney disorders, increased muscle tone or tension, hypertonia, pain in the arms and or legs, itchy skin rash, sleepy feeling, drowsiness, hemorrhoids, itching, dry mouth and skin dryness, dry eyes, sweating, feeling of weakness and malaise, anxiety, depression, asthma, lung infection, lung disorder, back pain, neck pain, bone pain, acne, leg cramps. Rare adverse effects of Herceptin may affect up to 1 in 100 people: deafness, blistering skin rash, wheezing, whistling, swelling or scarring of the lungs. Rare adverse effects of Herceptin may affect up to 1 in 1,000 people: jaundice, anaphylactic reactions. Other adverse effects reported with the use of Herceptin. The frequency could not be estimated from the available data. Other adverse effects may affect up to 1 in 1,000 people. Frequency could not be estimated from the available data. Abnormal blood clotting or clotting failure, high potassium levels, swelling or bleeding in the back of the eyes, shock, abnormal heart rhythm, shortness of breath, respiratory failure, acute accumulation of fluid in the lungs, acute narrowing of the airways, abnormally low blood oxygen levels, difficulty breathing while lying down, liver damage, swelling of the face, lips and throat, kidney failure, abnormally low levels of fluids surrounding the fetus in the uterus, failure of the infant's lungs to develop in utero, abnormal development of the child's kidneys in the uterus. Some of the adverse effects you may have may be due to your breast cancer. If you are given Herceptin in combination with chemotherapy, some of the effects may also be due to the chemotherapy itself. If you experience side effects, consult your doctor, pharmacist or nurse. Storage of Herceptin. Keep this medicine out of the sight and reach of children. Do not use this medicine after the expiration date which is stated on the carton and on the vial label after EXP. The expiration date is the last day of the month indicated. Store in a refrigerator, between 2 degrees Celsius and 8 degrees Celsius. Keep vial in outer carton to protect from light. Do not freeze. After opening the vial, the solution should be used immediately. Do not use this medicine if you notice any solid particles or color changes before administration. Medicines should not be flushed down the drain or put in the trash. Ask your pharmacist how to dispose of containers and medicines you no longer need. In this way, you will help protect the environment.